International Modern Hospital Superheroes. Only on 105.4 Radio Spice. Full to Twisted.
I am Dr. Shaju George, behavioral disorder expert in International Modern Hospital Mind Wellness Clinic.
What is the difference between a psychiatrist and a psychologist?
Before talking about the difference, both of them are mental health professionals.
Okay.
Both of them deals with mind. The difference being usually psychologist comes from an arts background and a psychiatrist comes from a science background.
Okay.
So a psychologist, they do their psychology, BA in psychology, MA in psychology, then MPhil and PhD in psychology.
Okay.
But a psychiatrist comes from science background, they do MBBS first, Bachelor in Medicine, then they go for the postgraduate course.
Okay.
And when we talk about the difference regarding management, a psychologist deals with basically with psychological treatments like behavioral therapy, behavior modification, CBT, cognitive behavior therapy, like non-medical management, non-pharmacological management basically.
Okay.
Psychiatrist is authorized to do both psychological management and also the pharmacological management.
Okay. So basically a psychiatrist learns psychology, but a psychologist only learns psychology.
Yeah.
Doctor, there's this big block, okay, that if I'm visiting a psychiatrist, I might be cuckoo. Is that right? Isn't that one of the biggest hassles that you face? And is this a myth, or do people who actually come are cuckoo only come? Or, like, who can visit a psychiatrist?
See, where there is a human being, there will be behavior.
Yeah.
I'm talking not only about human beings, in animal kingdom. Every animal shows behavior.
Yeah.
So where there is behavior, there is behavioral problems too. So any person can have behavioral problems, then they can visit a mental health professional. The problem being, psychiatry was not a well-developed subject till 1900, because we were not aware about where exactly the mind is or mind was. Only in the late 1900 or in the early 1900, we came to know that the seat of the mind is in the brain. Psychiatry is all about brain and its functions. So earlier people thought that the mind is all about the satanic forces and other exactly. So now we know that it is all about the brain, and it's otherwise we will if we define mind, it is a sum total of the brain functions.
Okay.
So now we focus it as just like any other specialty of medicine, we do have an organ, that is brain, and we are dealing with brain. So now the stigma is coming down. Earlier people thought it is satanic, so people were not approaching a psychiatrist.
Psychiatrist, equals mentalist.
Yeah.
Doctor, so many problems coming up in UAE, and as you just mentioned to me, there are hardly any psychiatrists, correct? Now, there's so many addictions that are being noticed. There's alcohol, there's of course eating disorders, too little eating, too much eating, and smoking. Smoking is a huge deal. I go to universities, I see these young teenagers smoking, peer pressure, I don't know, the glam quotient or whatever. How does one tackle smoking?
See, substance use disorders is a big problem. It's an epidemic in the world basically. And nowadays what happens is there is early age of onset. Earlier people, if they start smoking at the age of 17 or 18, now people start smoking by the age of 12, 13 or even lower than that. So it's a big issue. I'm not talking only about smoking, alcohol, other medications, other drugs of abuse. All these are big problems, especially the same scenario is same in UAE also.
Okay.
But smoking we very rampantly see in UAE. To address the issue of smoking, or to address any issue of substance of any substance of abuse, the most important thing is prevention. For prevention, the most important thing is giving value education and giving health education at very young age. In the sense, if you are able to impart this education in KG classes or in the primary classes, they will develop fear towards these substances. If we develop fear towards these substances, we may keep away from that. For that matter, our curriculum, we should be able to include these topics as a part of the curriculum. And our teachers should become role models. Our parents should become role models.
Sure.
From there it starts. Then the preventive thing comes into their mind. They are not going to experiment. Because experimenting with substance is just like experimenting with fire. If you experiment with fire, almost 99% you will get burns. There is a 0.01% chance that you may not get burns, but you will not risk with your life. So that is one thing. So prevention is the first and foremost. Second thing, if you are a person who started using substances, either from use to dependence, there is a long period. They may start using it, then they may go to a stage of abuse, then may go to a state of harmful use, then may go to a state of dependence. From use to harmful use, so harmful use means it's already made harm to the client. So from use to harmful use, you may not need medication and you may need only counseling and behavior modification. But once a person is in dependent state, then you need both medication and behavior modification. At times you may need inpatient treatment too.
Okay. And
in the case of smoking, what happens is, why it is having this much of prevalent, why this is prevalent? Because it is having social acceptance. Unlike other substances, there is no intoxication with smoking.
that's true.
If you take alcohol, the person will get intoxicated. If you take opioid, the person will get intoxicated. So there is no intoxication with smoking, especially with the nicotine. So then if there is no intoxication, no acute behavioral problem with smoking, especially nicotine. So that is why smoking is having that much social acceptance. So when a substance is having very much social acceptance, it is very difficult for us to impart the measures to quit from that particular substance. So to come out of a substance, the person should decide that I want to quit from this particular substance. That is the most important step. The person should decide when I should stop, how I should stop. Then he can seek help from a mental health professional. So when he decide upon that, if he is not decided, any person, any health professional who is sitting in the clinic or a hospital, when he or she comes to him for some other matter, he can advise. Yes, you do have the habit of smoking. This may affect your body in such and such way. So it is better to think about quitting smoking. That advice may help. Then upon that advice, he may take a decision to quit. So once you brood about quitting, then he can decide a date for quitting. He need not stop abruptly. If he stop abruptly, what happens is all these withdrawal symptoms will come. So usually what we will say is, a person has decided to stop, he can put a quit date after 15 days. So by that time he can reduce from 20 to 10, 10 to 2. Then after on 15th day, on the day of quit, he can approach the doctor again. If he wants to take the medication, he will get the help of the medication. There are medications which will help. So when we talk about medication, there are nicotine supplementing treatment and also the anti-craving treatments. Nicotine
patches too?
Yeah, they are nicotine supplements. So they may not release nicotine as when we smoke. They do release nicotine, but in a smaller amount. So the person will not get withdrawal symptoms. So why most of the person are using substances? It is not because of the positive effect of the substance, but because of the negative effect. To avoid this negative effect, to avoid withdrawal symptoms, that is the reason why people are using substances basically. So when we use nicotine patches, it will release nicotine into the blood and it will address the withdrawal symptoms. So if a person is not able to control even with the nicotine patches or nicotine replacement therapy, then he can opt for other medications. So varenicline is one medication which is available as Chantix or Chantix. Is one particular medication which is quite useful in nicotine cessation.
Moving on from smoking to another vice, it's alcohol. When do you declare someone an alcoholic?
Usually, generally we don't use the term alcoholic, and instead we use the term abuse, harmful use and dependence. But an alcoholic means an alcohol dependent syndrome, a person with alcohol dependent syndrome. To qualify a person to have alcohol dependent syndrome, he do have certain features. One is tolerance. For example, if I do get the kick effect with one pack, to get the same kick effect, if I am taking half a bottle or one bottle, that shows that I have developed tolerance.
Or a huge capacity.
Yeah, it is not huge capacity, basically the other way around. People will talk about huge capacity, but it is basically the other way around. His body is that much compromised. Rather than develop the capacity, his body has compromise to that extent. Okay. That means tolerance. If one is taking more amount to get the same effect, that is tolerance.
Okay.
Second, if he is giving primacy of taking alcohol over other things, he is not going to office, he is not attending his family functions, and he is spending most of the time for taking alcohol, again it is a sign of dependence. If he is showing withdrawal symptoms, for example, in the case of alcohol, if I do have an early morning drinking, I open drinking, then it is an indication that I am a person who is dependent. If I, even after developing all physical complications, if I am going for alcohol, then again it's a sign of dependence. So these are some of the signs which will tell you that you are a person who is either an alcoholic or an alcohol dependent syndrome.
Okay.
So once a person is in alcohol dependent syndrome, he needs treatment. Because it is just like any other illness. The message which we are trying to pass on to our client is, it is not a habit, it is an illness. If it is an illness, you have treatment.
Okay.
With treatment you can come out.
Did something similar happen to Michael Jackson? I mean, what was that about? Was that substance abuse?
Yeah, substance abuse.
Right?
Substance abuse. He was also abusing substance, but basically injectables.
Okay.
Injectables. So the problem with the injectables is, again, see, when we talk about substance abuse, it could be drugs or others. So drugs are either, it could be prescription drugs or off prescription drugs.
Yeah.
Probably, to my knowledge, he was using drugs of the substance of prescription drugs.
Okay.
In large doses as IV injectables. So you know the fatality of that, and he ended up because of that.
Okay.
So these are the complications which we can expect out of IV drug abuse. And regarding IV drug abuse, they may develop dependence very early because these are very much addictive. And the other complications also will come very early because we are using injectables. It will directly enter into the blood. So the possibility of getting infection, possibility of getting stroke, embolism, all those things are very common with injectables.
You know, doctor, this also brings me to another topic. We notice so many celebrities going into rehabs and, you know, being constant and repeated offenders of substance abuse. Why is this?
See, probably that is the beauty of the brain. I'm not talking about in the positive sense.
Yeah.
See, basically right-handed people, left-handed people, that is right brain dominant people, are those people who have artistic abilities. They may be good in arts, they may be good in sports.
Okay.
Unfortunately, these are the group of people who are vulnerable to develop mood disorders. They will be very much emotional.
Left-handed people, huh?
Left-handed people,
Right
they are
brain.
right brain dominant.
Okay.
So, in people who are artists or sports persons who are right brain dominant, right brain dominant or left-handed people are vulnerable to substance-seeking behavior
Okay.
because of their high emotional nature. Emotional problems will be all the more common in these kind of people, and they are vulnerable for substance using behavior. That may be one of the reasons. Second is, again, as we have discussed earlier, peer pressure and their scenario, circumstance, the world they are, all those things may be contributing to that. And again, they give more importance, rather than the family, they give more importance to their profession and other aspects, and definitely maybe a professional hazard. I will say it is a professional hazard. They will have a lot of parties. So maybe it is part of it. So any person, when they start taking alcohol, they are not thinking about the dependent stage. They may start it as occasionally, then it becomes usually, then it comes to the always level. So occasional, usual and always.
Okay.
So they start with occasional with their parties, and finally they will come to a dependent state. Since they have more often they are getting, they are in parties, they are more likely to develop dependence.
Okay. We spoke about a lot of bad things, but is it a bad thing to be dependent on too many good things? Like too much of good? I don't know, maybe having a lot of green tea or only having fruits or vegetables. Like, I don't know, good habits generally. Is it a bad thing to be, obsessive about good habits?
I don't know, and I may not comment upon that, because having good things, obsessed about good things is, I don't consider it as bad.
Yeah.
But especially we will talk about, everything when it is crossing the limits, it will become bad. See, if you are so obsessed about the green tea, if you are so obsessed about the green leafy vegetables, and if you are so obsessed about fruits, then definitely it is having a bad impact, no doubt about it. But we can talk in positive terms. The good things are always good and bad things are always bad.
Okay. Now something completely obvious, it's actually concerning my mom. I think she has OCD. I know it's obsessive compulsive disorder, but like, if I have my t-shirt like this, she'll be like, no, this is not right, that's right. And we just have so many arguments on this. Is OCD really an illness, or how do you know that this person has OCD?
Probably your mom is having obsessive compulsive personality disorder.
Maybe I exaggerated.
No, obsessive compulsive personality disorder and not OCD.
Okay.
How we can differentiate between OCPD and OCD? OCD people, they themselves will come and report to doctor or to any other person in the family that I am suffering from such a problem. I want to control it, I want to stop it, but I am not able to control it. And the difficulty with OCD is these are the people who are suffering a lot. Or the most distressing behavioral problem is OCD. Because they are trying their level best to control this behavior, but they are not able to control it.
And they
do have full insight into their problem that these things should be controlled, but they are not able to control it.
And don't tell me, are they usually very moody and very low and very...
See, OCD people generally once they develop OCD, they will have depressive symptoms too.
Okay.
Because they are not able to control themselves. Okay. But the situation is different with OCPD. Obsessive compulsive personality disorder people, they don't consider it as an illness. And it is not when we consider personality disorder, this comes out of minor psychiatric disorders.
Okay.
But because personality developed before the age of 18 years, they will not have any insight into their personality.
So it's like a part of them?
Yeah, they will think that is right.
Okay.
Because they are doing things perfectly. So what is the wrong in it? They will think like that. But for the person who is observing, it will be more than expected.
Cool.
But they will not accept it. But the problem with OCPD, the plus part of the OCPD is they are the achievers. They are the people who have contributed to the world. Because they are obsessive, whatever be their field of interest, they will be obsessive in it, they will work for results. But the minus part of it is, these are the people who may develop depression in later life.
Okay.
See, in their 50s and 60s, they may develop depression. Because they may not be able to cope or work as previously, or cope with the situations, demands, then they may go into depression.
Okay, and lastly, just quick tips as to how do we deal with stress at work? Because I think in UA this is one thing which everyone suffers from, stress.
Always the best thing to avoid stress is you should set a limit.
Okay.
To what extent you can stretch yourself.
Doctor, this is the problem. We set a limit, but boss doesn't.
No, I will come to that later. See, set a limit first.
Okay.
Then you will have a good time management. See, I was working from 8 to 4 when I was in India. And I was seeing roughly 40 clients, 50 clients a day. Even though my OPD timing was from 8 to 4, I was working till 7:30, 8 in the evening because I was not able to see these 40 clients in this time period. See, after I left that place, my junior actually he joined the same place and he is seeing clients from 9 to 4 and he is seeing these 40 patients and he is leaving by 3:30 in the evening. Okay, so if you plan your time and manage your time very well, definitely some amount of stress you can take away.
Okay.
See, what happens if I am not leaving by 4 o'clock and reaching 8 o'clock at my home, definitely there will be a lot of stress will be at home, stress for me and stress for my family members. So you set your limit and effective time management, that is number 2. Number 3, then you should have some relaxation sessions.
Okay.
Either chatting with your friends or going out or doing exercise. All these things will help. And number 4, engaging in if you are a person with a religious belief, you are attending religious discourse, religious rituals, prayers and all those things will help. And finally, you should get a good sleep. So here what happens in UAE, people are going to sleep by 1 o'clock, 2 o'clock in the morning. And they don't mind about going to, usually we go to sleep by 9 o'clock or 10 o'clock in the evening. Here the entire, whether children or working person or person at home, they will go to sleep only by 1:30 or 2 o'clock in the morning. But remember, whatever be the age group, we need at least 6 to 8 hours of sleep. Minimum 6 hours. So if you are not getting that much sleep, your work or performance will be affected. If your performance is affected, definitely your boss is going to scold you.
Yeah.
Then you will get all the more, you will have all the more stress. So get a good sleep. From there we can start.
Okay.
Get a good sleep, set a limit, good time management, and do engage in other activities.
And your life will fall in place.
Yeah.
Okay, thank you so much for your time, doctor. It was lovely talking to you.
Superheroes at International Modern Hospital, Bardhabai. Call 04 406 3000.